we're often told marriage is good for us,
Hmm.
right? Like it's linked to better health and all that.
Yeah, that's the common wisdom, definitely.
But then I came across this new study, and get this, it suggests being married might actually be tied to a higher risk of dementia.
Wow. Okay, that definitely goes against the grain.
It really made me stop and think. And it probably contradicts stuff maybe our listeners have heard before, too.
It absolutely does. And it really just highlights how complex this whole connection is,
Oh.
between our social lives, our relationships, and what's going on in our brains.
Yeah,
We've got some really interesting things to unpack today as we dig into this newer research
yeah,
and try to see how it fits or maybe doesn't fit with what we thought we knew.
exactly. So for this deep dive, our main source is this article, Being Married Linked to Increased Risk of Dementia, new study.
Right?
And it covers this research from Florida State University. But what's really key here is that it also mentions, that 2019 American study that seemed to say the complete opposite.
Yeah, that contrast is pretty stark. And there was that earlier meta-analysis too, right? Which kind of hinted things weren't so simple anyway.
Right. So our mission today, basically, is to uh, try and make sense of this unexpected finding.
Cut through the noise a bit.
Yeah, look at the research, think about why this might be the case, and not just get overwhelmed by, like, conflicting headlines.
Exactly. Let's piece together this puzzle and see what picture emerges.
Okay, so let's dive right in. The core finding of this new Florida State study.
Hmm.
What did they actually find about marriage and dementia risk?
Well, the researchers looked at a pretty large group, over 24,000 people in the U.S. They didn't have dementia when the study started.
Okay.
And they followed them for quite a while, up to 18 years in some cases.
Wow.
And the main thing they found was that the unmarried folks, specifically, people who were divorced or had never been married, they actually had a lower chance of developing dementia compared to the married participants.
That's the bit that really jumps out, isn't it? Because, like the article we're looking at points out, that 2019 study found pretty much the reverse. Unmarried people had a higher risk then.
Precisely. It's almost like looking at two sides of a coin. And that's what makes this area, well, kind of fascinating, but also tricky.
Right. It really forces you to look deeper than just the headline.
Hmm. You can't just jump to conclusions based on one study, especially when you have these apparent contradictions.
So, okay, this new study drops this unexpected result. What are some of the potential reasons? Why might they be seeing this lower risk in unmarried people? Does the article give any clues?
Well, one idea that often comes up with dementia is something called ascertainment bias.
Ascertainment bias. Okay, what's that?
The basic idea is if you're married, maybe your spouse is more likely to pick up on those really early, subtle signs of memory trouble.
Ah, right, because they see you every day,
Exactly. So they might encourage you to go see a doctor sooner than if you lived alone.
which could mean married people just get diagnosed earlier,
Yeah.
making it look like they have a higher rate.
That's the theory, yeah. Like if you live alone, you might just, I don't know, shrug off misplacing your keys for longer.
That makes intuitive sense.
It does. But interestingly, the article says the Florida State researchers didn't find really strong evidence for this being the main driver.
Oh, why not?
They pointed out that everyone in their study actually had annual doctor visits. So, the article kind of cleverly suggests that doctor visit was almost like a stand-in partner, also keeping an eye out for early signs.
Okay, interesting. So if it's probably not just about earlier diagnosis, what else could be going on?
Another really key thing the article brings up is the study sample itself, the people in the study.
Right, who were they?
The data came from the National Alzheimer's Coordinating Center, or NACC, and the article notes this group. Well, it wasn't hugely diverse, low ethnic and income diversity, and a big chunk, nearly 64%, were married.
So if the group isn't really a snapshot of the whole population, could that skew the results?
It certainly could. And the researchers themselves acknowledge this, that their findings might be more specific to this particular group.
Okay.
It might limit how much we can generalize these results to everyone else. It's always crucial to ask who was actually studied.
Definitely. A good reminder. The article also gets into the idea that marriage itself is, well, it's complicated, right?
Absolutely.
And maybe it's not this simple protective shield against dementia we might have thought.
Exactly that. The article mentions those previous meta-analyses, the big reviews of lots of studies, and how their results were kind of mixed anyway.
Right, I remember you mentioned that earlier.
Yeah, so that already suggested the relationship wasn't straightforward. This new study just adds more weight to that idea. It's likely more nuanced than just married, good, unmarried. Bad.
It seems like maybe the quality of the relationship or other factors might matter more than just the status itself.
That's certainly a possibility the findings point towards. It highlights these intricate ways that our relationships, um, our marital transitions, even our choices not to marry, might affect brain health over time.
Okay, now here's something I found really interesting. The article points out the lower risk for unmarried people was specifically tied to Alzheimer's disease.
Ah, the most common type.
Right. But not for vascular dementia, which is, linked more to blood flow issues in the brain, like from strokes.
That is a very significant detail.
What does that distinction tell us?
Well, it suggests that whatever is going on might be affecting different underlying biological pathways. Alzheimer's and vascular dementia, they have different root causes, different mechanisms.
So marital status might influence Alzheimer's risk differently than vascular dementia risk.
It seems plausible, based on this finding. It hints that maybe the social or psychological aspects tied to marital status interact more directly with the processes leading to Alzheimer's plaques and tangles, perhaps, than with the cardiovascular factors driving vascular dementia.
Fascinating. And it gets even more specific. They found that divorced or never married folks were also less likely to progress from mild cognitive impairment, or MCI,
Right, those early memory issues.
to full-blown dementia. And get this, people who were widowed during the study period actually had a lower risk too.
Wow. Okay, that widowhood finding is particularly intriguing.
It is, because you often hear about the stress of losing a spouse potentially being detrimental.
Exactly. So these findings about progression from MCI and the lower risk in the newly widowed, they add more layers. It suggests marital status might play a role not just in getting dementia, but also in how it develops over time. And it challenges some assumptions about bereavement, perhaps.
So the article then kind of pivots towards this idea of needing a more,
Mm.
what did it say, nuanced understanding.
Yes, that's a good way to put it.
It's not just a tick box exercise. Married, yes or no.
Precisely. The researchers are suggesting we need to look deeper. Think about the dynamics, like how happy is the marriage? How satisfied is someone after a divorce? What are the cultural expectations around being single versus married? How active is someone's social life if they aren't married?
So a stressful marriage might be very different from a supportive one, health-wise.
Absolutely. And maybe a single person with a really strong network of friends and activities has protective factors that aren't captured just by saying unmarried.
It feels like it's shifting the focus away from the label itself, married, single, divorced,
Mm-hmm.
and more towards the actual experience within or outside of that status. The quality of connection, maybe.
That seems to be the core implication, yeah. That what might truly matter for a long-term brain health isn't just having a spouse or not, but rather the level of support, connection, and maybe even fulfillment we get from our overall social world.
Right. Regardless of the official relationship status.
Exactly.
Okay, so let's try and wrap this up a bit. If we're boiling it down, what's the big takeaway from this deep dive into this new study? How does it change the picture?
Well, I think the main takeaway is that this research really challenges that simple, long-held notion that marriage is automatically protective for brain health.
It throws a bit of a curveball.
It does. It suggests the relationship between marital status and dementia risk is much more complex, much more intricate than we perhaps appreciated. We really can't make those blanket statements anymore.
Yeah, you can't just say being married is good or being unmarried is bad for your brain
Mm.
or vice versa.
Mm.
It's muddier.
Much muddier. And it depends on a lot of factors we're probably only just beginning to understand properly.
And it's also a good reminder, isn't it, that this kind of research is always evolving. You
Definitely.
get findings like this that seem to contradict earlier work, like that 2019 study, or fit with the more mixed picture from those bigger analyses.
Absolutely. It really underscores why we need to look critically at new findings. Consider the how, the who, the context.
Before we rewrite the rule book based on one study.
Precisely. Science is a process, right? Especially with something as complex as the human brain and human relationships. It's rarely black and white.
So thinking beyond this study then, instead of just focusing on whether someone's married or not, this whole conversation makes me wonder, what else about our relationships, our friendships, our communities? What other social factors might be really crucial for our brain health as we age?
That's a great question to end on. It pushes us beyond those simple labels, doesn't it?
Yeah.
It encourages us to think about the quality of our connections, the support systems we build, the sense of belonging we feel. How do all those things shape our cognitive destiny, you know? That feels like where the really interesting questions might lie now.